What is a polypectomy? Polyp Removal Explained. Imagine discovering a tiny abnormal growth inside your colon during a routine checkup. That's where a polypectomy comes into play. A polypectomy is a procedure used to remove polyps, which are small tissue growths that form on the lining of the colon. These growths are common and often harmless, but some can develop into colorectal cancer if left untreated over time. During a colonoscopy, a doctor inserts a flexible tube called a colonoscope into the rectum and guides it through the colon. The colonoscope has a tiny camera that allows the doctor to see inside and identify any polyps. Once a polyp is found, the doctor can remove it right then and there. The removal process depends on the size and type of the polyp. Small polyps, less than 5 millimeters, are usually snipped off with small forceps. Larger polyps may requiring a wire loop called a snare. The snare is placed around the base of the polyp, and heat from an electric current helps cut and cauterize the tissue at the same time, reducing bleeding. For very large or tricky polyps, the doctor might use special techniques like endoscopic mucosal resection or endoscopic submucosal dissection, which involve lifting the polyp with fluid and removing it in pieces or in one go. Sometimes, if the polyp is too big or difficult to remove through the colonoscope, surgery might be needed to take out part of the colon. After removal, the tissue is sent to a lab to check if it is benign, precancerous, or cancerous. This helps determine if further treatment or more frequent screenings are necessary. Polypectomy is generally safe and performed as an outpatient procedure, meaning you can go home the same day. It not only helps prevent colorectal cancer by removing potentially dangerous polyps early but can also relieving symptoms like bleeding or changes in bowel habits caused by larger polyps. Many polyps do not cause symptoms at all, which is why regular screening is so important, especially for those at higher risk. Because new polyps can form over time, doctors usually recommend follow-up colonoscopies at intervals based on your personal risk factors. The goal of a polypectomy is to catch and remove these growths before they turn into cancer, making it a vital part of colorectal health. Always remember, if you have concerns or questions about colon health, consult your healthcare provider for personalized advice.